Hi, welcome to our webinar on advancements in women's health, specifically talking about the FemTouch technology. Our office is located in Naperville, Illinois, and it is myself, Erin Peters. I am one of the nurse practitioners, as well as Paula Overstreet, who is also a nurse practitioner, and we both perform the FemTouch treatment in our office. Our office has a wide variety of treatment options. We focus in aesthetic and cosmetic medicine, but myself, I currently work in obstetrics and gynecology, and Paula has a previous history of 14 years in OBGYN. So we are both very comfortable in the women's health space, and specifically as it relates to feminine health concerns. We have brought on the CO2, the laser, the FemTouch technology about a year ago. We spent over a year researching which laser would be best. There are a couple of them on the market, but we felt like this laser, luminous laser, has been in the gynecological space, specifically gyne surgery, since the 70s. So ultimately, we felt like this was the best choice for us, and we are excited to get started and hope that you are able to learn something from this. So it's okay to talk about it. It referring to the many changes in gynecological health that ultimately happen to a lot of women. We see this every day, myself working in OBGYN and Paula with her background. We often come across women that are experiencing some type of feminine health concern as it relates, to whether it be vaginal atrophy, post-childbearing health concerns, but we just want our patients to ultimately feel comfortable talking to us about these health concerns because we are very comfortable talking about it, and we know that this is a problem for ultimately all women at some point in their lives. And so again, it's okay to talk about it, and we are here to answer any questions that you have. 1 in 3 women over the age of 40 suffer from some type of feminine health concern or health issue. These health concerns often will impact your quality of life. They may impact a relationship. And for a lot of women, they can be very bothersome and something that they may deal with every day. And half of women over the age of 65 are also going to have some type of pelvic health concern within their lifetime. So these concerns range anywhere from just a little bit of urinary leaking with coughing or sneezing to painful intercourse, frequent UTIs, frequent vaginal infections. So this is something that is very prevalent among women and women's health specifically, and this is something that we are addressing with this laser treatment. Just to go over a couple more statistics, according to previous studies done, we see that over 30% of women are going to suffer from stress urinary incontinence. Stress urinary incontinence being that with pressure that is put on the bladder, you experience some leaking. So that often will happen with coughing, sneezing, maybe heavy weightlifting, running. So a lot of women are experiencing this, not just post-menopause, but after childbearing as well. And then 50% of women experience what we call GSM, or that genitourinary syndrome of menopause. And that is, the vaginal atrophy that we talk about, which ultimately causes a lot of that thinning of the vaginal wall and will cause a lot of pain with intercourse. This is a really good slide that is just showing that alteration of the vaginal epithelium. If you look at the slide, you'll see on the left-hand side, this is a woman, who is postmenopause. And on the right, you'll see a woman of childbearing age. And you can really see the difference with the arrows on either side of the photo in the thickness of that vaginal epithelium. So postmenopause, without that estrogen and without that vascular supply, that vaginal wall becomes very thin and it is more susceptible to trauma. Hence why you may get some micro tears or injury to the vaginal wall with intercourse, because that epithelium is really there to protect. And so it protects against the friction with intercourse. So then if you look on the right-hand side, you'll see that there is many more layers of cells, and you also have a lot of increased vascularity when you have more estrogen with the photo on the right. And so you can kind of tell very clearly with that picture just the changes that happen to that vaginal mucosa and why some women may experience the things that they experience. So this just is an overview of some of the current therapies that are available, whether it be a prescription, an over-the-counter, or ultimately a surgical option. So vaginal moisturizers and lubricants. A lot of women will use lubricants or moisturizers specific, especially during intercourse, but they can be messy and they can be cumbersome, and ultimately it's not correcting the problem that is underlying for these women. And then estrogen therapies. We have a lot of different options vaginally as well as oral for estrogen, but not everybody is a candidate for these. There are risks and side effects associated with these therapies. And some women are not even a candidate at all, especially if they have a history of breast cancer and they cannot take any estrogen. So this woman is, the breast cancer patient would ultimately be a candidate for another therapy that doesn't include estrogen. Pelvic floor therapy. This is just like physical therapy for the pelvic floor to help address some of these concerns, and that can be pretty time consuming and expensive as well. And then a pessary, which is a device that they use vaginally to support if there is any prolapse of any of the vaginal organs. Prolapse of the uterus is an example of that. And then surgery. Some women have such severity of some of their symptoms, usually more talking about prolapse, where they would need a surgical option. And then ultimately the advanced technology of the FemTouch CO2 laser, which is a very well tolerated, quick laser procedure that we do in the office. And I will get into that a little bit more. And this, again, just overview of some of the prescriptions that we use. I prescribe some of these in clinic, and I hear women come in every day and they're so frustrated by the cost of some of these things. A lot of them are not covered by insurance, and so the cost can really add up, as you can see, anywhere from $150 to $300 a month. And this is something that you have to maintain. You have to use these creams or suppositories or vaginal rings continuously, because once you're losing that estrogen, you're not getting it back. So really, to maintain a result that you may achieve from these prescriptions, you do have to keep up with that. So it can be expensive. And this just mentions that the ACOG came out with a statement in 2016, and ACOG is the American College of Obstetrics and Gynecology. And this is really a gold standard for OBGYNs, and something that we refer to very commonly for our guidelines and clinical resources. So when they put out a committee opinion, it's definitely something that we are paying attention to. So in 2016, they stated that non-hormonal approaches are first-line choices for managing urogenital symptoms or atrophy-related urinary symptoms experienced by women during or after the treatment of breast cancer. This is really important. We have actually, fortunately enough, had the opportunity to treat a lot of women who are breast cancer survivors, because a lot of the medications that these women are put on can cause pretty severe vaginal symptoms after treatment. And a lot of these women are very young, and to experience some of the vaginal symptoms, such as the dryness or pain and burning or discomfort that they experience daily, they are not a candidate for estrogen. And so until now, or until we had some of these laser treatments available, they were really kind of, feeling like they didn't have an option. So they're the ideal candidate for FemTouch CO2, along with, a lot of other women, but this is a great option for them. And now there is something we can do about it. So as I mentioned, with FemTouch, it's a gentle CO2 laser. So with the CO2 laser, a lot of our patients will describe their experience as life-changing, or something that has made such an impact for them. And treatment results they notice with just one treatment. And so it's been pretty overwhelming, our success and our patient feedback, and we're just excited about it. We the laser itself is CO2 energy. Different lasers have different energies, and the CO2 specifically is targeting water in the cell, which water lives in a cell with collagen. And so we know that with creating these little tiny micro injuries in the vaginal tissue with the CO2 energy, that we're going to ultimately be able to rebuild and revascularize that vaginal epithelium with a very quick and pretty painless procedure in the office. This is just an overview, again, talking about vulvovaginal atrophy and different applications for this laser specifically. We get some great results with urinary incontinence and intimacy as it relates to pain with intercourse. And then even the lichen sclerosis, which is that inflammatory or inflammation of the external vaginal tissue as well. And I have had the opportunity to treat somebody with lichen sclerosis who's had a really great outcome with this laser. This is a picture of the vaginal probe in the vaginal canal. But basically, the procedure itself is going to consist of 3 treatments spaced 4 to 6 weeks apart. What we're seeing is we're often doing an extra 4th treatment on somebody who may be very atrophic, such as that woman who may have had some breast cancer treatments and is starting off a little bit more atrophic than somebody else. And that's something that both myself and Paula are really good at assessing. When you come in and we do an assessment, we'll be able to tell the level of atrophy that you're at and kind of be able to gauge, do you need that additional treatment to get the best result. The treatment time is really quick. It takes less than 15 minutes. And for the internal part, I have patients, often I'll have them say, okay, rate your pain 1 to 10. And just because they have to give me a rating, they'll say 1, but really it's very comfortable. The external treatment can be a little bit more painful, but we numb the area right when you get in the office. And so by the time we're doing the external treatment, which is after the internal, that area is very numb. And so again, that is also very well tolerated with very little discomfort. We do also recommend annual maintenance treatments. And again, that's because once your ovaries stop producing that estrogen or are putting out less and less estrogen over time, that vaginal tissue is not going to maintain that result without a little bit of maintenance. So that maintenance treatment is important. But even women who come in for maintenance at a year are still noticing improvement from their previous 3 series of treatments. And we do see improvement after just 1 treatment, but we strongly encourage the 3 to get the most benefit. And we've treated a lot of patients at this point, and every single one of our clients has said that they have had significant improvement in whether it be in urinary, vaginal moisture, lubrication, pain, in decreased pain with intercourse. But everybody has had some really amazing benefits from the treatment. This is showing, so there, like I was mentioning at the beginning, there are other options on the market currently for vaginal laser treatments that you may have seen advertised or talked about. And this is just kind of showing the difference between the laser versus a radio frequency device. So laser is, ablation. And what that means is it's very controlled dermal micro wounding or creating tiny micro injuries in that vaginal tissue. And, without causing that bulk heating or that prolonged treatment time, we're able to do it. Again, doing the treatment so fast, we're able to be very specific in the little injuries that we're creating without causing any underlying damage or repercussions down the line. Because thousands of treatments have been done during all their studies and research, and they have had 0 reported adverse events, which is really important to note. With these, again, with the tiny injuries that we create with that laser, that vaginal epithelium has an opportunity to heal pretty quickly. With radio frequency, sometimes with it being thermal only, meaning heating only, and it takes a lot longer to get to the result or endpoint that they're looking for. So the treatments can be 30 to 45 minutes. And there are possibly some adverse events that have been reported with some of those devices. So So again, that just goes back to the reason, one of the reasons why we ended up choosing the Luminous FemTouch laser. We think that as far as safety and efficacy, it is definitely the best. And who can benefit from the FemTouch treatments? So a lot of women can benefit, you know, not just that woman who is postmenopause, but as we mentioned, the women who may be childbearing and is feeling like she has some mild to moderate stress urinary incontinence, or pardon me, post-childbearing, who feels that she may be experiencing some of those urinary complaints, or maybe even laxity of that vaginal wall. And then the woman who has been through breast cancer treatments and ultimately is on some medications that, you know, put her into menopause and can cause some of those really significant vaginal atrophy symptoms. And a lot of those medications that the women who have had breast cancer are on, those medications can, I mean, I see their vaginal atrophy being tenfold with somebody who is just in that slower progression of menopause experiences. And it can be pretty disheartening for a lot of those women. So again, I'm really excited about this as an option for them. Patient benefits, it's a quick in-office procedure, you know, no anesthesia is required. We do that topical numbing, but by the time that the client or patient walks out of our door, that they're really going back to their normal daily life, and procedure being less than 15 minutes with no downtime. And then again, just stating that every 3 or 4 to 6 weeks. This reviews our treatment protocol. More than 90% of our patients at 1 year, as I mentioned before, still note some significant improvement. And post-treatment care. So when you leave our office, we always will apply a topical cream that is going to be calming, soothing, and that's going to help with that immediate discomfort. So in the first hour, sometimes there can be a little burning or a little discomfort, and not something that anybody, you know, you don't need a ride to the treatment. You don't need to not be going to the store, going back to work, or doing something. You can certainly go about your daily business, but it is something that I will have some clients say, oh, I did have a little bit of burning in that first hour, but after that, it truly was like nothing happened. But we do want you to refrain from vaginal sexual activity for 3 days. We say no hot tubs or no submerging in water for 3 days, no tampons, so anything intravaginal for 3 days. And you know, you may experience, especially if you have a lot of atrophy, a little bit of spotting immediate post-treatment. But if you had any bleeding or any fever or chills, we would want you to call us and let us know, because those would be considered to be unusual side effects. But I have not currently, and Paula has not currently had any of that. And as I mentioned, most patients will go on to resume normal activity. So this is the cost, because this is obviously a big question for a lot of women. It is currently not covered by insurance. We are hoping that one day that will change. The cost is often less than some of these current therapies that are available. The national average for a 3-pack of the FemTouch treatments is about $3,000. Our in-office cost is $2,400 for a 3-pack. And then for our special webinar pricing, it is $2,100 for a treatment of 3. And then our touch-up treatments are going to be $640 each. So that is that maintenance therapy that you would do annually is a $640 treatment. Care credit available, so that sometimes will help. Care credit is basically a credit card that you can use for different medical or cosmetic aesthetic procedures that are not currently covered by insurance. So that is an option for some women, because we do have people asking about payment plans. And although we don't offer specific payment plans, care credit is a really great way to be able to manage that cost. And we do have to just review any contraindications. So warnings and risks of CO2 lasers, they are solely intended to be used by physicians or nurse practitioners that are trained specifically in using these type of laser devices. So if you you go to a provider or go somewhere with incorrect treatment or misuse of the technology, that is when you could put yourself at risk for more serious injury. Again, remembering that there was no adverse events reported with this laser, but still just knowing that anytime you're using a laser energy, there are some risks associated, and CO2 laser, there are multiple CO2 lasers on that are used for different surgical indications, but as it relates to the FemTouch technology, there have been no adverse events reported. And also just to note that that luminous CO2 laser is contraindicated on patients using Accutane. This laser can be used as well for ablative face treatment. So that's why they mention that. And here I will have you just go ahead and watch this brief video that kind of reviews again an overview of the treatment, the FemTouch vaginal laser treatment, and we'll kind of give you an opportunity to see what the treatment itself would look like. Okay, and I hope that you were able to learn something today about the FemTouch laser, and we hope that you are coming in soon for your free consultation. Give us a call at 630-369-2767 and mention that you watched this webinar to receive that special webinar pricing, and we look forward to seeing you soon.